Hi everyone, this is Kayla, LuckyVitamin's Junior Category Manager of Vitamins, Minerals, and Herbs. It's great to have so many people joining us today for the LuckyVitamin Wellness Webinar, The Interest of Homeopathic Medicine, presented by Ollois. Thank you all very much. Today we are going to hear from Guillaume Louis, the co-founder and CEO of Ollois, the first line of lactose-free homeopathic single medicines. Born in France and raised with homeopathy, Guillaume has 22 years of experience in the field of homeopathy and natural medicine. He has worked and helped to develop the homeopathic category in France, Spain, Mexico, and the U.S. Guillaume is also the CEO and co-founder of Brandstorm HBC, which specializes in the import and distribution of unique homeopathic supplement, vitamin, and body care lines in America since 2011. Before I turn things over to Guillaume, just a few quick reminders. This webinar is being recorded and will be emailed to you after its conclusion. If you have any questions during today's webinar, please enter them into the question box on your screen. At the end of the webinar, we will try to answer as many as possible. The promotion code will be given at the end of the presentation and will be available for 72 hours. Thank you all again, and I'm going to turn this over to Guillaume now.
Thank you so much. Thank you so much, Kayla. Do you hear me well now?
Yeah.
Yes, perfect.
Did you
Thank you so much.
get the thing to change your screen over to you? You should have to accept it.
Okay. I did it. So thank you very much. You should all see the screen here. I wanted to thank first LuckyVitamin for organizing this webinar. I think it is very important to share some information about homeopathy in the US. It is a medicine that is not widely used yet, but I'm going to try to share with you some data as far as where homeopathy stands in the world and here in America, and also how does it work, what it is exactly homeopathy, and then we'll talk obviously about Ollois, our brand. First, I wanted to disclose that I am not a physician and therefore will not be able to answer any therapeutic question. What I've been doing is working literally since the beginning of my career with homeopathic medicines. As Kayla was saying, I worked in Europe. I was born and raised in France, where homeopathy is widely used, and I'll share that with you a little bit later on. And also I've traveled around the world and I've seen where homeopathy is the mostly used, and its effectiveness, amazing testimonials from people in Mexico, in Europe, here in the US. And hopefully I'm going to convince you that homeopathic medicine is the natural way to a better health. So without further ado, I'm going to talk about homeopathic medicines. First, about homeopathy in general. Here I'm saying it's a new trend because it's gaining momentum here in America. We'll see a little bit later on that it's a very old medicine, though. It is not new at all. It's actually one of the oldest medicine that we can think of as far as the use of medications. But we'll talk about that later. As of right now, the World Health Organization, WHO, states that homeopathy is experiencing a 20 to 25 growth globally each year, and most importantly, is the #1 complementary and alternative medicine used around the world. When I say complementary alternative medicine, is basically what is not a conventional OTC drug. But we'll see later on that homeopathic medicines are treated by the FDA as actually a over-the-counter medication. But I think the data of number one complementary alternative medicine use around the world is very important, because there are a lot of alternative and complementary medicines. There are supplements, herbs, Chinese medicine, acupuncture, vitamins. And I know it sounds surprising here in the US because the use of homeopathic medicine is low yet. But when you compare it with herbal medicine or supplements, it is actually very, very important to share that homeopathy is number one in the world. For example, in France, where I was born and raised, there is like pretty much a homeopathic medicine in every single medicine cabinet, in every single household. Homeopathy is very, very widely used. As a matter of fact, the number one over-the-counter medicine in France, and I'm talking about all over-the-counter medications, the number one is a homeopathic one. My mother gave me some homeopathic medicine every time I had an injury or an acute symptom, and I thought this is what everybody was doing around the world. When I traveled to Mexico, I found out very rapidly that 80% of the Mexican population uses Arnica, for instance, which is a homeopathic medicine based on a flower, which is Arnica montana. It's the active ingredient used for pain and bruises and muscle soreness. 80% of the American population uses them on a regular basis. In Germany, it is very big. In France, I said. In India, there is a lot of Indian population using homeopathy. So yes, here it's picking up momentum a little bit, actually very rapid. In the US, in 1995, we were talking about $170 million of homeopathic medicine sold, went up to 875 and 70 million in 2009, according to the National Center of Homeopathy. Right now, we are estimating approximately $1 billion in sales annually. This is significant. I mean, obviously, compared to conventional drugs, it's still very small, but it's becoming more and more popular. As a matter of fact, in the US, when you look at the food, drug, and mass channel, and I'm talking about pharmacies, pharmacy chain, or supermarket, conventional supermarket, homeopathy is experiencing a 17% growth, and that's more and growing more rapidly than regular conventional over-the-counter medications. So, I remember when I first moved to the US 12 years ago, I went to my local pharmacy and looking for my homeopathics, as I used to do in Europe, and I think I saw like 1 or 2 items on the shelf. Nowadays, even in a regular pharmacy chain, there are, I think, more than 60 or 70 homeopathic medicines that can be seen on the shelves. Of course, if you go to a natural supermarket like health food stores, like Whole Foods, you will find a lot of homeopathic medicines because they've been embracing this category since the very beginning of their existence. But the fact that outside of the natural industry, homeopathy is growing very fast and faster than regular conventional medicines means that there is a demand from the population for safer medication to treat acute symptoms. Not only there is a growing demand, there is also more buzz around it. I think it's you've seen a lot of recalls in the recent past from pharmacy chains of OTC children's medicines like cough syrups, etc., because of the side effects, etc. And that has been forcing people to at least think if there was an alternative, if they could treat their children differently, maybe find other options that might not be with the same number of side effects, that could be more natural, etc. You also have a lot of products like children's cough syrups, for example, that are labels for 6 years and over. And it also, makes the choice a bit more complicated for parents, because, if you have a 2-year-old or a 1-year-old child with symptoms, you might not find the proper medication on the shelf if it's not for homeopathic medicine. So I think the idea that I want to share with you with that slide is that everywhere else in the world, homeopathy is very, very well used, and here in the US it's growing very rapidly, and the fact that there are so many people attending this webinar today actually backs it up. There is more and more awareness and more people, especially parents, looking for a safer alternative for their children. So, going to the next slide now, after talking about the overall situation of homeopathy, I wanted to spend some time talking about what homeopathy is. Because, you can't be comfortable taking a medication if you don't know the concept, if you don't understand what it is, and if there is any evidence that homeopathy works, how is it regulated, etc., etc. So I'm going to start with the very first question: what is homeopathy? So homeopathy is a medical practice based on the idea that the body has its own ability to heal. I promise you that if you cut yourself, you cut the skin, you're going to heal by yourself. The body, our body, has an amazing capability of self-healing. A lot of people think that homeopathy, or say that homeopathy is placebo, but we'll talk about it and show the evidence that it is actually not placebo. But most importantly, the way it works, I think, is going to make sense for you. Homeopathy is based on the principle that likes cure likes. It is something that we've been seen and known for years, centuries actually, and we'll talk about the law of similars a bit later, which is what likes cure likes means. So what does like cure likes, cures like means? If a natural substance in Mother Nature can cause a symptom in a healthy person, giving this person a very small amount of the same substance may help with the illness. I'm going to give you an example. I know it's not exactly the same as homeopathic medicine, but I think that everybody understands about the flu shot. For example, the flu shot is, when you think about it, they take the actual virus each year, the virus that would cause symptoms, in that case flu. And what they do is they give you a very small amount of it, and that stimulates your body to react and to build up some build up your immune system. So it is very well known that when you take a very small amount of a substance that can cause a symptom, your body is going to actually be stimulated. So what we do is we speed up the natural healing process of our body. So instead of being sick for 2, 3 days, 10 days, like a month, what we are going to see is find the substance that could cause the same symptom in Mother Nature, give you a very small dose of it, and speed up and stimulate your natural healing process. It's a self-regulatory process that everybody is aware of, but sometimes we need a bit of a push to make it happen. I'm going to give you another example. Arnica, I told you about Arnica. Arnica is a flower. It's called the mountain daisy, Arnica montana. And when you find them, you can see those beautiful flowers in the Alps or higher in the. Well, if you were to touch those flowers with your hand, or when you hike and you rub the flower on your legs, you will feel some pain, some muscle soreness, even bruising, because the substance is toxic. The flower is toxic from Mother Nature. Not everything that is natural is actually safe. In order to be safe, we have to dilute it, to reduce the amount of active ingredients, and that's what we do with homeopathy, and I'll explain to you how we do that. So basically, when I have soreness, muscles, bruises, stiffness, I will take a homeopathic dilution of Arnica, the flower, or I will put it on a cream. And what it's going to do is going to speed up my natural healing process against this bruising, and you'll see the pain disappear. You'll see the bruise being reduced, and much more rapidly than if you were not taking anything. Your symptoms are going to disappear. This concept of likes cure likes has been actually shown the first time and talked about by Hippocrates, which was 400 years before Christ. So it's been a long time. It is not something that we just discovered recently. But Dr. Samuel Hahnemann, who was a chemist in Germany, was the one who actually started researching and trying to prove that likes cure likes, or the law of similars, was in fact true. So he started in the early 1800s, and what he did is he discovered the truth of the law of similars by testing small doses of the medicine on himself first. And then he started to expand with his patients. So what he's done is he's been taking a lot of substances from Mother Nature and repertorized the symptoms caused by these substances. So some of them were causing diarrhea, some of them were causing muscle soreness, some of them were causing anxiety. So he would describe all those symptoms in what we called a book called Materia Medica. And basically what he came up with was the toxicology of each substance. Nowadays we know very, very well. We don't have to do some tests on individuals to know that, for example, arsenic, the poison arsenic, is lethal. You take a small amount of arsenic and you're going to have diarrhea. You're going to have all the symptoms of food poisoning, for example. And if you obviously take too much in very, very high dose, you actually maybe suffers the consequences and die. So of course he would administer small doses so people wouldn't die, but still describe the symptoms. After that, he started diluting those symptoms, those substances, excuse me, and would give it to him or to his patient. And of course, as you dilute the ingredient, you can see less and less symptoms. So if you start giving a smaller and smaller dose of arsenic, for example, you will finally have no negative symptoms. It's going to reach a point where the product is so diluted that there is absolutely nothing happening. It's not harmful, but it's not therapeutic either. It's just neutral. But he went further on and kept diluting and administered those dilutions to his patients. And surely enough, he was able to prove that after a certain threshold of dilution, the product starts having a therapeutic effect. A little bit like what I said about the shot and the virus for the flu. So obviously, we use in homeopathy the same substances, but diluted enough so they are therapeutically effective. And the fact that we dilute them so much, they also do not have any side effect. Those substances are not toxic any longer, obviously. And this is very, very important to emphasize that, and we'll talk about the benefits of homeopathy in general after that. But the fact that we are above the threshold of toxicity means that there is no side effect, no contraindication, no basically the medications are not harmful. And this is very important because the basics of medicines, you know, since the very beginning is first do not harm, you know. So we are exactly within this purpose right now. And but not harming is definitely not enough. You also want to be therapeutically effective, and so we'll talk about later on about the evidence that homeopathy works. Now, after Dr. Hahnemann discovered and developed this concept, it's widely accepted in countries like France, in Germany, in India, Great Britain. Actually, the family doctor of the Queen Elizabeth is a homeopathic doctor, is a homeopathic physician. So they are like the homeopathic hospital, the Royal Homeopathic Hospital in London is one of the most important hospitals there. And it was the case in United States when homeopathy started and really got developed 100 years ago. There were a lot of homeopathic hospitals in the US. After after a while, unfortunately, unlike in Europe or in Mexico or in India, here in the US it kind of disappeared a little bit. There's been a lot of pressure from conventional pharmaceutical companies that started to come to life. We have to remember that before regular conventional medicines existed, the only way to treat people was with homeopathy. I mean, besides herbs and Chinese medicines. But Dr. Hahnemann was the first one who actually invented the concept of taking a pill. He went to one day he went to a bakery shop because he had those dilutions of substances, but he didn't know how to use them, and thought of a way to administer those medications to his patients. So he went into a bakery and found those little sugar pellets on the cakes, and thought it could be a great idea to use those pellets, medicate them, and tell his patients, why don't you take 5 pellets, 3 pellets, and see what it does. And so he was the first one more than 200 years ago to actually implement the concept of taking a medication with a sort of specific dose, way before tablets and capsules were invented. But the challenge that we have now is that you have the power of the pharmaceutical industry, and homeopathy decreased and almost disappeared in the US. So we had to start all over again approximately 30, 40 years ago. It's growing fast, but we still have a lot to catch up with compared to other countries in the world where homeopathy never disappeared, and it's still one of the #1 medicine used. Now, is there evidence? Because one thing, as I was saying, is to be safe and no side effect. But does it work? Well, There are literally hundreds of high quality and published clinical studies, preclinical, full clinical studies showing that homeopathy works. What they did, and I'm going to emphasize a little bit on it, is double-blind randomized clinical studies. So basically, you would give a group of people a green pill and then a red pill. Nobody knew which one has the active ingredient and which one is the placebo, which is basically no active ingredient, and evaluate, measure the effectiveness, how the symptoms disappear or are being reduced. Nobody, not the patient nor the physician who is actually analyzing the results, know which one is the true medication and which one is the placebo, so nobody is biased by it. And even though the placebo group does show some improvements, as we know, and as I said at the very beginning, we have a capacity to heal by ourselves. Our body is an amazing self-regulatory process. So of course there is some improvement even if you don't take anything. It's approximately around 30%. But when you look at the group that took actually the actual homeopathic medicine, the difference is significant. So significant that the studies have been published in respected journals like Lancet Pediatrics, Rheumatology. A few years ago, a journal here in the US about using calendula to palliate the side effects of chemotherapy in cancer patients. So it is significant, and it is proven that homeopathy works better than placebo and therefore has its efficacy. It's been shown with babies. It's been shown with animals. If you give a horse or a dog that is being sick, you give them some pellets, you put them in the water or directly in the mouth, and you see an improvement. Nobody can say that it is because of the placebo effect. Animals don't know that you're giving them some medications or what type of medications you're giving them. So it is being proven that it works. Those studies have been published and can be found online, etc. Now, how homeopathy is regulated here in the US? Well, the US Congress passed a law in 1938, so I'm not talking about 2 days ago, 1938, declaring that homeopathic remedies are to be regulated by the US FDA in the same manner as non-prescription over-the-counter drugs. That's why on the tubes, on our tubes of pellets or any homeopathic medicine for that matter, you can see a claim that is different from the ones that you have for supplements, for example, dietary supplements or vitamins or minerals. You can actually use over-the-counter claims for homeopathic medicine. You can see you can talk about runny nose, about difficulty falling asleep, about diarrhea, about pain and bruising, and this gives us and you also consumers the confidence that you are taking the right product. I've always been, when I came to the US, for example, I went to find some vitamins, and I saw some product on the shelves, and like vitamin B12. Well, gosh, I have no idea what it is for, and it's not written on the package either, because dietary supplements can't use the same claims. So this is an advantage that we have here for homeopathic medicine. It kind of shows that exactly what you need it for. If I go to the next slide, and this is very important to summarize the benefits, we talked about the fact that it's natural, but not just natural, because as I said, you have a lot of poisonous natural substances out there. And if you take too much vitamins, if you take too many minerals, you might see side effects, which is not the case for homeopathic medicines. So it's natural, but it's also safe and non-toxic. There is no side effect. There is no interaction with allopathic medication or dietary supplements. Therefore, it is amazing for children, but also for adults. And children are actually responding very, very well to it because they have a very clean body. Yet they don't have taken a lot of medications, hopefully. So their immune system is great, and if you stimulate it a little bit, you're going to see amazing results with homeopathy. But also for adults, obviously, and elderly people. I sometimes, we forget to mention that because we focus more on children because it's spectacular there. But if you are taking a lot of prescription medication for, I don't know, arthritis, for any type of chronic conditions, and you also, guess what, you also have difficulty falling asleep. So you go to the pharmacy, you don't really know what to take because of the interactions, because you're already taking a lot of medications. So taking homeopathy here would help tremendously without the interaction with the other medications. So it is obviously a huge benefit. Now, the different forms of homeopathic remedies. I know in the US you have the pellets that we are going to talk about. They're the ones that we use for with Ollois. These are pellets. You can see on the picture on the right. These are white spheres. They are made of. They used to be made of sucrose and lactose. We were able to remove the lactose from those pellets, and now they are sucrose based only, and therefore they are lactose free. And for the ones that are plant-based, because I forgot to mention that what we use as an active ingredient, we not only use plants and flowers and things like that, but we also use minerals, and we even use some animal-based product. Like, for example, there is one called Apis mellifica, which is actually the bee. So if you have, when you think about it, when you are stung by a bee, or you have any type of inflammation, it's swollen, it's itchy, it's reddish. These are the same symptoms as a bee sting, for example. So what you do, you take a homeopathic medicine of the bee and its venom, and you're going to speed up the healing process against that. So the pellets are actually convenient for the whole family. You can also find drops, you can also find syrups, solutions, creams. Bottom line, you have a lot of big variety and nice range of solutions available in the US. How to read labels, though, is sometimes a little bit more complicated, at least different from what you are used to as far as supplements or conventional over-the-counter medications, because we use Latin names. All the active ingredients is in Latin. So, as I said, Apis mellifica is the bee, but we don't put bee, we put Apis mellifica because everywhere in the world we can use the same Latin name and everybody knows what it is for. Then it's followed by the dilution. There is a number of the dilution. I'll talk to you about that later. And you can find single medicines. This is what we do with Ollois. We have one active ingredient only that has a certain purpose, and the purpose is written on the label. Or you have combination formulation, like cough syrups, that are going to combine several active ingredients that could help with different symptoms based on the condition. So, for example, Arnica montana 30C would be how to read the active ingredient for a single remedy. Or you have a combination formula, and those combination formula most of the time have a commercial name. Now, with Ollois, what we have are tubes of pellets. So these are medicated pellets, obviously, as I was saying. You have approximately 80 pellets in the tube, and what you do is you put the tubes upside down, so the cap is at the bottom. You twist the cap, and pellets will fall into caps with each twist. So once you have 3 to 5 pellets, you remove the cap and you put them directly under the tongue. It is very important to take homeopathic medicine under the tongue sublingually, because this is the fastest absorption way after the intravenous one. We have millions of capillaries underneath the tongue, below the tongue, that are going to help the medication to be absorbed rapidly. It goes directly into the bloodstream without having to go through the digestive tract, and therefore it is more efficient and it acts faster. You'd let the pellets dissolve, and usually the standard usage is 3 to 5 pellets, 5 pellets 3 times a day, excuse me, as a standard rule. This is what is written on the tubes. Now, it is important to mention that we want to give the body, maybe a push at the beginning. So it is okay to take the medication more often at the beginning. So it's kind of like if you run out of gas with your car and you have to push it to the next gas station. At the very beginning, you're going to push harder to get the car in motion. Once the car is in motion, you have to push less. And if you happen to be downhill, your car is going to roll by itself. You don't even have to push it anymore. This is what we do with homeopathy with the body. We push it at the beginning. We stimulate it so it reacts against the symptoms by itself. So yes, it is okay to give it a bit more often at the beginning. Let's say, for example, Arnica, and you have like a child crying because of a bump in the forehead. It is okay to give the medication maybe every hour, and then you separate the dose as the child improves it. And once you are good, when you don't feel the symptoms anymore, you can actually stop taking the medication. That means your body took over, and that you basically resolved the problem by yourself. Your body took over, and we are not masking the symptoms. It is not like a pain relief where you don't feel the pain while the medication is still working, but the pain comes back when it's not. With Arnica, when the pain is gone, that means the symptom is gone, that means the inflammation, the swelling is gone, and that means you're going to be fine and you don't need to take the medication anymore. So we have 45 remedies total. They represent more than 60% of the total sales. In general, we don't have a full line of medicines. We started with those top 45, but as I said, they are the most popular ones. We have product for difficulty falling asleep, which, guess what? We have for all the common illness. We always want to keep to over-the-counter uses. We are not pretending to have people self-medicate themselves for chronic condition. We recommend for any chronic condition that you go and consult a physician. But yes, for runny nose, difficulty falling asleep, temporary diarrhea, rashes, etc. We have a range of medication that can help very, very well. And lastly, but not least, I wanted to tell you a little bit about the dilutions, because it could look like confusing. As I said before, we dilute the remedy, we dilute the active ingredient. So there is a number after the name of the product, and this number means the number of dilutions that have been used. So 60, for example, Arnica. Arnica is the most popular one. It's actually the #1 natural pain reliever in the world. Arnica is used for trauma, bruises, stiffness, and muscle soreness, for example. But depending on the level of dilution, there is a different sub-use, let's say. And this is why I use the target as an example, as an analogy. The 6C, the 6C means it's been diluted 6 times. That's the way it's been invented by Dr. Hahnemann. So 6 times, 12 times, 30 times, and 200 times. 6C would be less diluted, so there is more active ingredient. It's more concentrated. It's kind of like the bullseye on the target. You see, it's darker. It's more limited. It's smaller. So you're going to treat local and recent symptoms, bumps and bruises. The next grid on the target will be the 12C, the next dilution. It's a little bit more diluted. The symptom is a little bit more spread out. And it's perfect for surgery, recommended before and after surgery. I think like when it makes sense when you think about like plastic surgery, for example, patients having a rhinoplasty, a nose job, they are not just bruised on the nose, they are bruised and swollen all over the face, so it's more spread out. So we'll use the 12C for that. The 30 is the next ring on the target, and it's even more spread out, so it's for general pain. Even at that point, we starting to see chronic pains, chronic conditions like chronic back pain, etc. And lastly, the final grid in red on the target, and red also on our dispenser here on the picture. You're going to ask me what's next after the whole body. Well, the emotions, the mind. If you're traumatized not only physically but emotionally, if you've been in a car accident and you are afraid to drive again, or if you're an elderly person and you walked in the street, you fell, you hurt your hip, you go back home and you stay in bed, you're not only experiencing pain, physical pain, but you are afraid to go out again, to walk again. You're traumatized emotionally by the fall. So you want to use a higher dilution. In that case, it's the 200 CK. But the 30C is the most popular one because it regroups everything. It regroups general pain, chronic pain, and of course, when you look at the target again, the smaller rings are included in the larger one. So at the end of the day, the most important is not necessarily the level of dilutions, but the fact that you choose the right remedy, and then it will work. So that's what I had wanted to share with you as far as the dilutions and homeopathy in general. I think it's almost 10 to the hour. So they told me that in the last 10 minutes we could have time for questions and answers, and that's what I wanted to share with you. And I wanted to thank you all for attending this webinar. I know it's in the middle of your day, busy schedules, everyone. So thank you so much for spending 1 hour of your time listening about homeopathy. And obviously, thank you to LuckyVitamin.com for supporting Ollois. All our remedies are being sold at LuckyVitamin.com, and that's definitely the easiest way for you guys to get them. So thank you, Kella, if you want to take over.
Sure. Thank you, Guillaume. That was full of great information. We do have some questions we want to get right into. Our first question, are there any homeopathics that can be taken for extended periods of time to boost immunity during cold and flu season?
It's a good question. They are. What we do with homeopathic medicine, we speed up the healing process. The challenge in America is that we are not allowed to claim any prophylactic use. Okay, so we cannot mention, because of the FDA regulation, any prevention treatment for cold and flu, etc. We stick to therapeutic use. So when you have a cold, when you have a flu, when you have a cough, yes, you can go to your Lucky Vitamin website and or natural stores and look for homeopathic medicine to help with those symptoms. And there are tons of them, and they work very, very well.
All right, thanks for that explanation. Next question. What are the best homeopathic remedies to always have on hand in the house?
Good one too. I always have, I'm going to share personal experience, based on my childhood with what my mother was doing and what I do with my kids and my wife. You always want to have some Arnica. Arnica montana, those little tubes of pellets that I showed you before. Arnica montana 6C, for example, is amazing to help with bumps and bruises, and especially for children, you have that all the time. Or if you work out a little bit too much one day and you have muscle soreness. I don't know, you're playing tennis and you get hit by the ball and you have like a pain. It is the most amazing homeopathic remedy you can find. So I would always have that one in my medicine cabinet. The Ollois Arnica 6C or 30C for general pain. I would also recommend, a lot of people do that, and again, I'm going to stick to what's written on the label because I'm not a physician, so I cannot recommend, I cannot diagnose or recommend medication. But if you go, for example, on the website and you look at Coffee Cruda that I mentioned before, when you have, you're tired, you go to bed, but the minute you lay down, you start thinking about a million things, and your brain doesn't stop working, and even though you're very tired, you cannot go to sleep. Coffee Cruda 30C by Ollois is an amazing medication to help with difficulty falling asleep. And maybe the last one I would recommend to have always on hand is Nux Vomica. Nux Vomica 30C by Ollois is a medicine that helps with indigestion, hangover, overindulgence type of issues after Thanksgiving, eating too much or drinking a little bit too much, partying. Nux Vomica recovers so much faster from those symptoms that I will always have them on hand at all time.
Thank you for all those good suggestions. We have time for one more question. Are there any homeopathic remedies that should never be administered to children under the age of 5?
Well, they are basically yes and no. Basically, you always have to stick to what's written on the label. The FDA is very strict as far as labeling, and we have to comply with the regulation of any other over-the-counter drug in America. So before taking any medication, please read the label. If it says do not give to a child below 5 or below under 2, don't do it. Now with Ollois, because we are talking about single medicines, there is no age limit, there is no limitation as far as giving it to a child. We always recommend not to give to any child below 6 months old in general, but besides that, there is no limitation on our Ollois product selection. But for the other ones out there, other brands or other products, please stick to what's written on the label.
All right, thank you for that explanation. We're going to wrap this up now. Thank you all again for attending, and thank you, Guillaume, for all of the information. If you have not already done so, please register for our upcoming webinars. For more information, please visit LuckyVitamin.com and search keyword webinar. Please see the screen for an exclusive promo code. Reminder, this code is active now and will be active for the next 72 hours. Again, thank you.
Thank you.